Two health professionals, quality assurance coordinator Celso Carrera and medical laboratory technologist Ruby Aguillon, journeyed to Mexico City to receive a 2-day practical training on the detection of the COVID-19 virus that has health officials in Belize on high alert.
We have algorithms of how we will diagnose, how we will treat each patient, because we won't be testing everybody at the moment. We brought the reagents, primers, and probes for the testing. And so basically this week we set up the test, and we had a trial run, and well, that's where we are right now. We are up and ready to start screening for the new coronavirus.
As the new coronavirus makes its way across the borders, at the Central Medical Laboratory in Belize City, Carrera, Aguillon, and other health professionals have acquired the knowledge and equipment to quickly detect the new disease. Samples are received by the biological units, and with primers and probes, tests are carried out to do initial screening for COVID-19.
The first thing we need to do is to screen the documentation that comes along with the sample. And after screening the documentation, the first procedure is to test for influenza B, influenza A, and other respiratory viruses, which includes the common coronavirus that is circulating here. So after doing that through PCR, then we interpret the results. After interpreting the results, then we would determine if we need to do the screening for the new coronavirus strain. And if we do not need to do this screening, then we release the results to the different institutions with the findings that we obtain and the reason why we're not testing for the new strain of coronavirus.
And that reason is that the possibility of co-infection is extremely low. If the virus is detected, Aguillon says that further testing is conducted. Reagents are utilized on suspected cases.
And then we proceed to the second room, which is the master mix room. That is a sterile or clean room where we prepare our reagents that we're going to use to analyze our specimen. Those reagents include primers, probes, and so that's the room we use. No sample is allowed to enter there in order for us to keep the room clean and free of contamination. And then we have a third room, which is the amplification room. In that room, we already combine the reagent and the sample, and then we have machines which are used to analyze the sample and determine if the target we are looking for is present in that specific sample.
If a sample is tested positive for COVID-19, a protocol is followed and key persons in the Ministry of Health and Government are informed, which leads to an emergency plan being activated to prevent the spread of the virus.
Professionally wise, this is a plus for the country, and not only the country. If we look at the region, right, because the virus can come through Guatemala, it can come through Mexico, So we have this regional approach whereby if the whole region is in unity and everybody is screening, so when the virus does reach, let's say, Mexico, the alarm will be triggered. So now here in Belize, we are already prepared to respond to this.
Reporting for News 5, Hipolito, Novelo.